Uh, Hello everyone. I'm Dr. Soumya Chakraborty, consultant orthopedic surgeon, R.N Tagore Hospital, Mukundapur, Kolkata. So today I'm going to talk about this knee replacement surgery. So this is a much discussed topic these days because you guys get a lot of exposure from social media, all the YouTube channels and everywhere. While lots of videos and everything is uploaded already. So today I'm going to talk about that what are the recent modifications which have come up. So the most important thing I'm going to talk about is we these days are doing a small or a mini incision surgery. So we are doing the knee replacement surgery with only a 6-inch incision. So this is helping in quick rehabilitation of the patient, and also it's like reducing the pain in the knee. So this 6-inch incision is one very important thing, and one more important thing is we are retaining the posterior cruciate ligament or the PCL ligament. So what helps in these PCL retaining knees is you feel that your knee is actually yours, so it helps in quick rehab and also like pain relief of your knee. And one more important thing is that we have got various modification of implants these days. So earlier we used to do the knee replacement surgery with only cobalt chromium implants, and these days we have got these gold knees or titanium nitrobromide coated implants. So this actually helps in longer survival of implant, and also this is this actually prevents allergy from the implant material. So these days we attempt to do the knee surgery in relatively younger population. Also at the age of 50-55 we can advise for knee replacement surgery because the implant is supposed to survive much longer. So, and also we have got these Oxidium implants. Oxidium is a short or a abbreviation for the oxidized zirconium. So this Oxidium knees are very good knees. They are also allergy resistance, and this is claimed that this implant survive for at least 30 years. And also we are doing a quick rehab protocol for all the knee replacement surgeries. So within 3-4 days the patient can walk unassisted, unaided. A patient don't need any crutch or walk or anything, and also pain and everything gone in the next 15-20 days. So this is a very quick rehab protocol. Like whenever the patient is discharged at the end of 3-4 days, patient can climb stairs, patient can use the commode, the patient can walk on his own. So the replacement surgery is not that difficult these days. So like whoever is having any problem in the knee or severe knee osteoarthritis, please consult your doctor and you can get your knees replaced. So wish you all good health. Thank you.